I'm very happy to have this sit down with Dr. Bradley Calabrese. Bradley is a plastic surgeon based in Louisville, Kentucky.
Yep.
Okay.
Yep.
Is one of the good things that we bring from Kentucky, along with mint juleps, bourbons, the Kentucky Derby.
Yeah.
But he's my next favorite thing.
Yeah, that's what we think. I love that you love bourbon so much, and you just got a Maker's Mark gift, which is sort of funny. It kind of reminds us how small the world is.
It is.
You know, that I just come right from Kentucky, and we're such bourbon country.
And it's not your first time in Israel.
No, I was here 3 years ago. I truly love Israel. So many of my friends are Jewish, and so I have so many friends here in Tel Aviv and in Israel. Coming here is sort of like coming home in a way. For me, I feel very comfortable. I speak to somebody from Israel every week. Like somebody, you know, we're so connected in education.
That's really good.
For that.
So, as we talked before, I know that you're very passionate about medical education, and you're traveling to the entire world, all continents, talking all day long about giving education about plastic surgery to plastic surgeons all around the world. Where did you get this passion?
Yeah, you know, or craziness, it may be, you know, doing that. I think, you know, I did a fellowship with Pat Maxwell in 1996. And I think he just got the bug because I just emulated what I'd seen, and that's what he did. He was such a free thinker, and he was an educator, and he was traveling the world also way back then. And so I just started doing what I was taught to do, and it slowly just kept evolving into something. And today I look at it and I go, I don't know how I got so involved in so
world famous breast surgeon.
Yeah, and trying to share that, you know, but it comes from a really honest place. And the place isn't trying to be a world educator, world leader.
Okay.
It is just trying to be an educator. And I think I do that with my patients every day. I do it with my residents. I have a fellowship. I do it at home. I do it in our domestic meetings as well. Get involved in our aesthetic society and all the things related to education. And then the next level is then more internationally and being involved in that. But you know, being involved internationally in education teaches us so much that you bring back to the United States because we're too global.
Okay,
we are too
sure.
connected.
Yeah.
We learn more ideas and more things from like coming to Israel. Such great concepts. You gave a lecture today, which I'm like, I do the exact same procedure that he just described, but we did it in our own ways. And sometimes it just reaffirms what we do, that like minds that are doing these operations a lot, do them the same way, and we bring that back.
We're brothers at heart.
Yeah, brothers at heart, exactly.
Yes. One question. You have a very busy practice, and it's mostly, I heard, secondary cases, hard cases, cases that other plastic surgeons had problem with. You're probably fully booked. How do you have the time to travel? How many times a year do you travel abroad to give lectures?
Oh, how many meetings I go to is, I would say on average, I would be gone half of the weekends of a year. Someplace, whether that be domestic meetings or international meetings. I will go probably to maybe 10 or 12 international meetings. We just came out of COVID, and I already, in the last 3 months, went to Costa Rica, and I was in Austria, and I was in Italy, and I'm now in Israel. I go to
downhill.
I'm going to Puerto Rico.
It's going downhill.
It's going uphill, right? Exactly. I go to Puerto Rico in a couple weeks, and then plus the domestic meetings.
I love it.
I go to Peru next year. I'm doing a virtual meeting in Argentina. I was supposed to go to. So I think that you have to find a place in your life, and I think it would be hard with children and with a lot of responsibilities. I mean, I'm nearing 60 years old, and so it's a little easier. You know, your life's a little more established, and you can travel more. You're not leaving all your responsibilities at home every time you leave. I think for many plastic surgeons, I remind them all the time, you can't be plastic surgeon of the year, world famous plastic surgeon, the biggest educator, the biggest publisher, and be father of the year.
Exactly.
You just can't.
Yeah.
You can't, you know, in order, I always say, to be great at something, you gotta be bad at something.
Yeah.
So
you have to give up.
So you're gonna have to make choices for that. And so for those of us who have the ability to do it and aren't deserting our children along the way, we try to contribute in a way that builds our profession.
By the way, we said the name Pat Maxwell.
Yeah.
Okay. I'm gonna interview him tomorrow.
Yes.
How is it to be a fellow of Pat Maxwell? He was world renowned even then.
Yes, he was.
Tell me something nobody knows about it so I can surprise him.
Well, he did not keep the cleanest desk.
Okay.
Right. And so the only way you could get a message to him, if you need to remember, would be like to put it on his seat or put a sticker on the chair, because it was the only thing that was empty.
Okay.
That was like not things, because his mind was so moving it all the time. He had so many projects going on. And this is back in the day when we didn't have computers with PowerPoints on them. He had slides. Yeah, so I think that, he's so smart, so much passion, so much going on. You just get that bug and you feel that from him. And you as a fellow, you were just trying to help him do all that he did,
Okay.
right? And keep everything at home and in the practice still with
That's
the continuity. While he was gone and busy doing things. But it was amazing how much time he still had doing the surgery. I did surgery with him all the time. So,
Did he let you operate during the fellowship?
Yeah, he did. I was very lucky. I think one of it was Pat saw something in me, right? So
Yeah.
I would hear from his team, oh, he really trusts you because he lets you do things and he lets you operate more. And he was probably my biggest advocate. He believed in me more than I believed in myself, right? He saw something, and I think this is really formidable because it made me believe in myself a little bit more.
So
and
you got
believe
vindication.
Yeah, because I don't think you can have a good perspective on who you are, what you are, how good you are as a surgeon, what you know, what you're capable of doing. But today I have residents and fellows, and I completely see it that I tell who are the superstars that come through my program, and you just see there's something different about them in how they operate, how they think, how they can potentially contribute in the future.
So do you empower them?
Yes, you try to fully. So, and I have a junior associate, Dr. Chet Mays, who is really great. He was my medical student many years ago, 10 or 12 years ago. He then went through all of his training and then came back and joined me in practice. And he's going to be a future educator. I just put him on podium last week for a couple of national talks, and he enjoys it and loves it. So building his career and following that is really, really great. So, you try to get those around you who want to do it, the time and the place to be able to do it. So I can open doors for him, but then you got to walk through it and perform.
No, he'll open his own doors, I'm sure, if he's good.
He's super great.
I have a question. When you were a resident in plastic surgery,
Yeah.
who did you look up to? Who were those kind of plastic surgeons you said, I want to be them?
Well, it was Pat Maxwell for sure. It was Scott Spears for sure, because I was really interested in breast surgery. It was related to that, and also Tom Biggs. Was super great. I mean, I used to say Tom. I
just said his name.
Yeah, you just did, because he was so known in breast surgery, but in all of aesthetic surgery. He was also one of the great international surgeons, very connected to the ISAPS, organization. And so, but he was really funny, and he would come and talk to me after, he would give me advice after I would give lectures, which were really helpful, and I would I was just at the Texas Society meeting, and so I was doing Tom Biggs' voice, he talks like this, now Brad, now listen here, now here's what you do. And I would use his voice in the operating room. I would say, when we would irrigate the pocket, he'd say, well, it could look like champagne, it can look like rosé, or it can look like burgundy. You got to see what it is. We want to have some champagne here, so you want to have no blood in the pocket.
You're channeling your inner Tom Biggs?
Yeah, nice. Exactly. That was my inner Tom Biggs. So, but he has no idea that I followed him. But I have a great picture of me, Pat Maxwell, and Tom Biggs at the Atlanta Breast Meeting, and just remembering that these are some of the giants. There's many, many more who are really giants. And I always watch Mike Shefflin and others as well. It was one of the Israel boys. They were so connected.
So I have a question. What is your day-to-day practice like? What are your bread and butter surgeries that you do? And what is the surgery that you're most known for?
Yeah. Well, what I'm most known for is augmentation mastopexy.
Okay.
And so we wrote a textbook this last year during COVID on augmentation mastopexy. But every place I go, I'm always going to be giving a lecture at some form about augmentation mastopexy. More recently, it's about soft tissue support, like the use of meshes and the use of ADMs as it relates to aesthetic breast surgery. So my daily practice, so we have a big practice. I have 77 employees. We have 3 locations. We have a big spa. We have a big practice. But I operate a lot, even though, because a lot of these meetings, I just am gone on the weekend or for a couple of days. And I do maybe 4 to 5 or 6 surgeries a day. I operate, usually my operating day is about 10 hours. I operate 4 days a week. And so
crazy.
we'll do a lot of surgeries. I have a big team. When I am in clinic, I usually have 4 nurses and 2 medical assistants with me. So there's 6 of them, just because I run a big group, running a big practice for that. But we give our patients like so much care and so much attention. We try to make it not feel like a big machine, but more like a well-oiled family, taking care of them. So I think it's a little different.
What's your favorite surgery? It's sometimes differing from what's your most known for.
Well, what I would say is if I had to do the same operation all the time, it would drive me crazy. So I love the fact that I do facelifts, I do tons of body contouring, I do tons of tummy tucks, as well as all of my breast surgery. But my favorite surgery is revisional breast surgery. And it's my favorite because it's in that operation that I think I have a skill set that most people don't have. And maybe that's just because I've just done it so much, and they can be challenging cases. I was in Austria a month ago, and I did live surgery, and it was somebody who had 3 breast surgeries before, and she was a lovely, like a model Instagram person, and she struggled with symastia, so the breast coming together, bottoming out. I went in and reconstructed her with a Neocet pectoral pocket. I put in mesh, etc. And she's doing great. She's 2 months out. Those are the kind of operations where you can go in and you can just do it in a very slick way. I give homage to Pat Maxwell, who taught me how to think about how I do these operations, and then you evolve and grow beyond that point. But he set the stage for what I do today, and so I try to sort of think and be innovative, just like he was innovative. I'm sure maybe in many ways we do things different now than each other because you evolve. I do more things like you. You see, we do the same augpexy.
I evolved from my mentor, Boris.
Yeah, and you gave him honor today in talking about where you started learning the principles, which I think is what we should always do.
Always do. I agree.
And you were building on it. Yeah.
I have a few fun questions.
Okay.
You don't have to answer if you don't want to. Yeah. First of all, what's your favorite OR music?
Well, we tend to listen to easier things like Lady Gaga. We would listen to Adele. I have a team. We listen to a lot of Broadway show. I put on Sirius Radio, and we listen to Broadway, and then I test them and quiz them on maybe who won the Tony Award for that show, what year was that show in, or things like that. So we've done that for 20 years.
Quizzes in the OR.
I have a first assistant, Lisa, who's been with me for 25 years, my whole practice, forever. And then I have my resident and my fellow, and then I have my nursing team, my scrubs, and my anesthesiologists and CRNAs. And so I tell them that they need to study the workbook if they haven't learned it by now. So,
what's your favorite food? Is it a Kentucky food?
Yeah, no. My favorite food is Italian food, because I'm Italian. So probably spaghetti is my favorite.
Is there a specific dish?
Spaghetti and meatballs is my favorite dish. That being said, because I would avoid carbohydrates a lot, it's super simple, like lasagna, all that. But I would say I don't eat it very often these days. It's very special times. And then you probably only at a certain restaurant that I love that's Italian or a homemade. So.
Do you have a hobby that's totally outside of plastic surgery?
Yeah. I work out every day with the trainer. So I would say being at the gym and working out is a super big hobby of mine. I think
every day?
Every day.
What time?
6 a.m.
Ah, okay. So you start with it.
So I get up at 4 a.m. every day.
Oh.
That's just my day.
Jocko Willing. Wow.
Yeah. And then I work, I drink coffee, and I work on paperwork and on things I need to do, talks for this meeting. And then I go to the gym at 6 by routine, done by 7, operating by 8, then operate till 5 or 6, and then I'll do some easier work at night, but I will do my big heavy lifting on the weekends or during the day. Because by the time you get to evening, and if you got up at 4 a.m. and you have a glass of wine, you're getting pretty tired by about 9. And so I'll try to get to bed by 10:30, and have a normal 6 hours sleep. You're
a crazy person, but that's okay.
Yep. Yeah.
4 a.m. Oh my God. Okay. Outside of Israel and the States, what's your favorite country?
What do you mean outside of the States?
No. If we take out the United States and Israel, because
I can't take out Israel.
What's your favorite?
Italy. Yeah, in Italy, and I've been there probably 10 times.
Where specifically?
Well, I've been to Positano, I've been to Tuscany, I've been to Venice and Florence and Rome many times. If I was only allowed to go to one place, it would be Rome, because it is just fantastic, and they got great shopping, and they've just got so much to see historically. I'm a super Catholic. I'm very involved in my Catholic church, and so it has the religious components to it, historical components.
And the food.
It has great. So I was in Greece a couple months ago, and I was happy to be there to see the Parthenon, to see the Pantheon, and the history as well that you see in Greece. But Italy is just great. So I was just in Milan at Lake Como, and it was fantastic. It's so different than being down in Positano.
Yeah.
I'm thinking one country that has this many great things in it. It's fantastic.
Such different people.
It's totally different.
One last thing.
Yeah.
If some of our residents, our Israeli residents, are watching this interview and they want to become big, what's your? It's like there's no one advice that you can give them, but is there one thing that you have, kind of a take-home message that you can give them?
Well, I think that you don't try to be big. What you try to do, you don't try to step ahead of things that are supposed to be. What you should do is stay honest to yourself, stay honest to how much time you want to commit, whether it's important to you, and do it in an honest way. Do it because you want to be an educator. You want to educate. You want to affect. At the end, what you want to do is affect patients' lives. And you and I can only do so many surgery on so many patients.
For sure.
That's it. But if you want to affect our profession and the kind of surgery that's done in our profession, the best way to do that is to try to help educate and try to take the young surgeons and help them build on that, because then they become better, they serve their patients better, and you've affected more lives by doing that in a very honest way. And then you see what comes of it, and if you're just in your own town, if your own practice, you're doing well and you're serving your patients well, that can be enough, and that can be more than enough. To be a world-class educator, takes many, many years. I've been 25 years in practice. And it's, and you've got to be willing to leave it and not do it for the wrong reasons. If you do it for fame or for something that's elusive like that, I think you'll be left forgetting that there's a ton of work that steps into it. If I come to a meeting, I have to come to a meeting, right? But people forget there's a ton of talks to put together and preparation and travel preparation to get here, that you don't just come and meet people and give talks. And so you have to be willing to do that. I think most people probably don't want to give up that much of their time to do it. I don't think, once you have to get into the work part of it, like I have a very long CV, I've published a lot, but when you have to sit down and write the first words of a paper, like the first sentence of a paper, and do it over and over again, sometimes you're like, why do I do this? It's crazy. So for the residents, be great as a plastic surgeon. That's by far the most important thing you can do. If you want to educate, start to contribute in small ways, and find your way. And if you find yourself evolving to a place that's more of that, then you do it, and do it and be great.
Thank you very much for your time.
Well, thank you, Oren. Thank you.
It's a lovely time to interview you. I feel blessed.
Yeah, well, thank you. I feel blessed to have you interview me and to be part of this and be here in Israel and part of the TLV Breast Meeting. You know how much I love Israel, and so it's just like family to me, and I have a special love for all the people here. So I look forward to coming back.